Psychoanalysis is a type of therapy created by Sigmund Freud. Based off of his theory of the id, ego, and superego, psychoanalysis is not commonly used anymore. However, it is an important part of psychological and therapeutic history. The goal of psychoanalysis is for the patient to gain insight. This allows them to grow more than was previously possible. Psychoanalysis also assumes that id and superego conflicts consume a lot of energy. This therapy aims to reduce these conflicts so the patient can become healthier. A patient's analysis in psychoanalysis therapy is based off of the therapist's interpretation of what the patient has and has not revealed to them. This means the therapy is highly subjective and depends upon the validity of the therapist's conclusion. There are 4 key parts in this therapy: free association, dream analysis, transferences, and resistances. Free association and dream analysis are both techniques used, while transferences and resistances are aspects of a patient's behavior the therapist observes. Free association is when a therapist says a series of words and the patient says the first thing that comes to mind. Freud believed this would allow the therapist an entrance to the patient's unconscious, in which the therapist would then inform the patient of what lurks there, granting the patient insight. Resistances are any hesitations, avoidances, and slips of mind on a topic during free association. Psychoanalysis therapists often interpret these as mental blocks. These reveal to a therapist subjects that are either being avoided, repressed, or are uncomfortable. This tells the therapist a lot about the patient and assists them in developing their interpretation. The second technique in psychoanalysis is dream interpretation. Dreams are analyzed as part of therapy due to the presumed connection between the dreams and the unconscious. The therapist interprets the latent content of the dream and tries to find a deeper meaning to it. Transferences are a phenomenon that occurs between a patient and a therapist, in which the patient projects their feelings and attitudes for their outside relationships onto the therapist. For example, if the patient is mad with their boyfriend or girlfriend, they would also become mad at their therapist. Psychoanalysis is a big part of psychology's history, but it is not practical or particularly proven to work. This type of therapy takes an extremely long time to complete and requires a large sum of money from the patient. The end.